Alia Husham. I am specialist dentist in Dubai Cosmetic Surgery. I am part of the team here to give the best service to our patients. I finished my master course in Baghdad, Iraq. Then I studied in Germany and finished my cosmetic dentistry in Köln University in Germany. Here I'm going to talk about cosmetic dentistry. Cosmetic dentistry is a big field of dentistry. It have many treatments. First, I like to introduce one thing. That's what we call it facelift dentistry. What is facelift dentistry? Facelift dentistry, all of us, when we start getting old, we start to have those wrinkles and lines around the mouth and in the lower part of the face. And most women, they start to run here and there looking for something that they solve this problem, like putting some fillers, Botox, or any other cosmetic treatments. And some of them, they go directly to facelift or surgical facelift. But here I want to mention one thing. This, we can solve it by working on the teeth alone. What I mean by that? Because our lower face, from this area, from the nose to the chin, is totally controlled by the vertical dimension of the teeth. I mean the distance between the upper jaw and the lower jaw. When we're getting old, and not necessarily also when we're getting old, sometimes some young patients, they have this problem if they start to lose this vertical dimension because of wear of the teeth. So when this problem happens, the lower jaw become near the upper jaw and this distance become less. And this gives us an old look. Sometimes some people like 25 years old, but they look like 40 years old. The facelift dentistry is come here, okay, to solve this problem by working on the teeth alone. How we can do that? It's the patient come here to the clinic, we do checkup, we measure the vertical dimension between the nose and the chin, okay, and we can determine, because we have our normal values, okay, we can compare that to the normal values, and we can tell the patient that if he has this problem because of losing the vertical dimension of lower face. When the patient is diagnosed that he has this problem, now we start making pictures, models, study models, okay, and we start to elevate this vertical dimension slowly within the physiological limit. What I mean by within the physiological limit, that to the limit that the patient tolerates. So we increase half millimeter every 2 months until the patient feels very comfortable with the new vertical dimension. Then we start to restore the teeth permanently. We start restoring the anterior teeth first and giving the patient a new veneers, new crowns, okay? Then we go back to the back teeth and we restore, and then we go back to the posterior teeth or the back teeth and we restore them with inlays, onlays, or crowns. It depends on the clinical situation. For some patients, the problem is only or mainly on the anterior teeth. So in this case, sometimes it needs just simple procedure, not necessitate that big dental work. Okay, so we can do just porcelain veneers for the anterior teeth or porcelain crowns and give the patient more natural look